Okay, so we've been talking about the coronavirus every day here on ActTV's Twitchcast and on the Facebook page because we are in a vacuum of government leadership. We know it's our job to spread accurate information that empowers everyone to make good choices about our health and to protect the people around us. Today, Anthony Santella gives us the latest update on the virus and the best ways to address it to curb the spread. Dr. Anthony J. Santella is an associate professor of public health at Hofstra University on Long Island, where he teaches in the graduate public health programs and undergraduate community health and LGBTQ plus studies program. He is a public health scientist specializing in infectious disease prevention and control. Perfect timing. And he has interest in HIV, AIDS, hepatitis C, and emerging illnesses like COVID-19. Doctor, thank you so much for joining us on the Twitchcast today.
Thank you for having me.
A busy time for you, no doubt.
Yes, it's one of those things where, usually people don't care so much about public health, but now that it's at the forefront of everything we do, it's getting a lot of attention.
Experts are saying that the virus can be stopped, but only with these harsh steps. Can you, and that was an article that you wrote, can you talk a little bit about that? Are we doing too much? Are we doing not enough?
Yeah. First, let me just start by explaining what public health is, because that term, I've never heard it being used so much, and I feel like most people don't really know what it means. So public health is the art and science of keeping communities of people healthy, free from disease, injury, disability, and death. And so while most people have regular contact with a doctor, a dentist, a nurse, one-on-one, our patient are entire communities of people. And so you're seeing that play out. And one of the key things we do in public health is infectious disease control. And so it's my opinion and the opinion of a lot of other, I think, credible scientists, like I heard you mention Dr. Fauci and Dr. Birx, who are on the federal task force, that we need an aggressive public health response to this. And that makes people feel uneasy, anxious, and officials are asking people to take action in times of uncertainty, and that's difficult for a lot of people. And so the best thing that we can do right now is to test, isolate, and treat people who have COVID-19.
And people, I find that people who are not in big cities are less likely to follow the quarantine, not mandates, but suggestions. Perhaps they don't feel the immediacy of the issue, but by the time the immediacy should hit, it's going to be too late. Is that right?
And that's the dangerous thing about what we're facing right now, is that, while half of the US cases are in the state of New York, that makes a lot of other people, including places outside of the New York metro area, feel like, oh, this is their issue. I'll just go about my day and I'll just, take a little extra precaution, but I'll be okay. And we know that what makes this virus so difficult to stop is the asymptomatic nature that it has. So, I'm exposed and infected today. I may not see signs for 5, 6, 7 days from now. And so, yeah, I'm going about my business. I'm going to the gym. I'm going to the grocery store. I'm interacting with people. I feel fine. But inside, that virus is replicating. And people are extremely infectious during that early period after infection. So that's why you are seeing these pretty aggressive measures for people to stay at home. That's the best thing we can do right now.
So people, tactics like forced isolation and school closings and pervasive GPS tracking of patients are bringing divided reactions. And I think arguably, especially the GPS tracking of patients.
Yeah.
Yeah. What do you make of that?
So
We're already, go ahead.
yeah. We're in interesting times right now. First, let me just say something about the schools, because I know that was very controversial in places like New York City, where there's so many people who rely on the schools for a lot of things. Closing schools is never an easy decision because, as we know, a lot of children rely on schools for breakfast and lunch. When kids are home, then who's watching them if parents still have to go to work? Are teachers, especially K-12 teachers, prepared to provide distance education? There's a lot of things that go into that. And so that's, I'm glad I'm not the one who has to make the decision about closing large school systems. But that was the right thing to do. When it comes down
stopping the spread of disease.
For stopping the spread of disease.
Mhm.
the best thing, we can do is stay at home. And, while I'm certainly sometimes critical of the way our government officials are handling this, let's wait the 15-day period that you're hearing from our federal officials right now is what's needed, because we won't know if this really works until about 2 weeks from now, when people start following the guidance. The whole thing about, following people and GPS and monitoring people, there's only so much you can do. I mean, I said earlier that part of the aggressive public health approach is to test, isolate, and treat. Once you find out people have something that is communicable, like COVID-19, a big part of public health is doing contact tracing, seeing, okay, I'm infected today. Who have I been in close contact with? Then I have to notify those people, get them tested. That's why, there's a sudden urgent need for public health officials to act in their emergency role so that they can help do this contact tracing. That's how we'll really curb this pandemic, is by.
How will we know in 2 weeks? How will we know? And I'm just hesitant to think like, oh, in 2 weeks it'll all be gone and
No,
we'll be
yeah,
back at the bar.
yeah. We definitely will not be cheersing a drink in 2 weeks, but we'll know if the aggressive measures that are being implemented widespread right now have some impact. I'm not concerned, as someone who follows public health and epidemiology and surveillance, that the graphs that Governor Cuomo is showing each day are peaking. That makes sense. We're increasing testing capacity. There's a huge backlog of testing. So for the next couple of weeks, we're going to see this continued increase in number of cases. That's not a bad thing, because those people know they have it and they can be either treated at home or in the hospital. What I'm concerned about are the people who are not getting the tested and need it. So, in short, we need to implement these widespread measures now, and then in a few weeks see if people really do follow the rules. Then are we starting to see a slowing down of the number of cases?
You have said that medical experts should be at the microphone now to explain complex ideas like epidemic
Epidemiology.
curves, social distancing, and off-label drug use. What happened to Dr. Fauci?
I feel like that's the next hashtag we're going to see on Twitter. Where's Dr. Fauci?
I think it's there already.
Yeah, it probably is. You know, as a public health scientist, I feel good that people like Tony Fauci from the National Institutes of Health and Deborah Birx from the State Department are on this federal task force. They are career scientists and clinicians who have gone above and beyond to curb other infectious diseases, including HIV/AIDS, which is really where they're best known for their work. And certainly from my what I'm seeing and what I'm reading, he's been pretty open about not being told to say certain things or not saying certain things. I think they're trying to balance who's at the forefront between Tony Fauci, Deborah Birx, and Jerome Adams, the Surgeon General. Probably, there's this is my own hypothesis or 2 cents, that there's probably obviously some bickering between them and who should be at the forefront. Deborah Birx is technically the coordinator of the task force, but Tony Fauci is the one who people want to hear from. The Surgeon General came on just yesterday or the day before and started saying this is going to be a very bad week. That went without explanation. Their messaging isn't always on the same page. And so I think they're probably taking a few steps back and saying, okay, you know what? Right now, we want Deborah Birx to be the face of this. And
It
so,
seems to me that Donald Trump is more concerned about, the stock market than he is about the pandemic. Is there? And I'm not putting words in your mouth. I'm just saying what it seems to me. What? eh, 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 Of course, we have to be concerned about the economy. What kind of response could the government be doing that would both stimulate, not that you're an economist, but
no.
that you would see would stem the tide of disease and also maybe not tank our economy?
Yeah, um, while keeping small businesses open and making sure people can apply for unemployment and ensuring that people can pay their bills and, get the resources that they need to be compliant with these aggressive public health measures is important. Public health should be number one on everyone's list. And I certainly hear that message from our local and state officials. I don't necessarily hear it from our federal leaders. And I completely understand that they have to be concerned about everyone's well-being, but right now it's about keeping people healthy and free from disease. The other things like people paying their taxes and their bills and and those sorts of things are important, but not if people aren't alive and healthy.
Yes, they won't be paying their taxes if the
Yeah.
death part of death and taxes
Yeah.
comes forward. What should we know about the healthcare system at this time? What needs to happen in order for it to withstand the virus?
So, in some respects, it's almost our reactions is too late because, on average, the federal government, for every dollar spent on healthcare, only 3 cents go toward public health. And you can't not have a system in place and a workforce in place, then all of a sudden expect it to respond like that. And so we're seeing the consequences of not investing in public health and pandemic and emergency preparedness right now. And so, we've heard over and over again, I know everyone's probably sick of hearing flattening the curve, and it's almost too late for that. On a good day in a New York City hospital or
Okay,
urgent,
hold on.
yeah,
Get some liquor in here. No, I'm just kidding.
on a good day, our city and urban hospital and healthcare systems are overwhelmed. And now you're saying all of a sudden we need to double the hospital bed capacity in New York State, which is why these temporary facilities are being opened up in places like Westchester and Long Island. That still will take on if everything moves quickly, at least a couple of weeks.
Governor Cuomo wants to open the Javits Center to 1,000 to 2,000 beds.
The Javits Center, I know on Stony Brook and SUNY Old Westbury campuses on Long Island, they're going to build temporary hospitals. In Westchester, they're converting an art center, I think, into beds. I mean, these are bad times if that's what we're resorting to. And
is that even healthy? I mean, the Javits Center is like you go see a car show and then that's where your hospital bed is.
I'll hold my comments on that one, but
okay.
but you can't react now for something we should have been planning for 10 years ago, and that's unfortunately what's happening. And so what I hope, one thing that comes out of this is that as we think about in the future and head towards elections in November, that people hold their legislators accountable for their voting record and their support for emergency preparedness and pandemic preparedness.
Do you see a difference between the parties in terms of voting record? Or no comment?
I'll say no comment on that. I'm not equipped to answer that right now.
Mm-hmm.
Yeah.
Well, we'll keep an eye on it.
Yeah.
And what do you recommend individuals do personally to respond to this time of crisis? I know that you are personally putting out, and we've talked about it before you came on, a program for children so that they can have a child appropriate, different age appropriate conversations about COVID. But let's start with the adults and then we'll move down to the children.
Yeah, sure. So first and foremost, the messages that we're hearing over and over and over again, and I will repeat just for sake of being a good public health professional, of washing your hands, so basic personal hygiene. The virus hates soap. And so by washing our hands repeatedly, it's like breaking down the virus. And we're constantly, I wish we would have kept a diary of how much we touch things and ourselves during the day before all this happened.
I just touched myself while we were talking and I'm like, I touched my face.
Yeah. So things like, covering your mouth when you cough or sneeze, washing your hands repeatedly, staying home if you're not feeling well,
It just occurs to me that I assume that because we wash our hands when we come in and we wipe the doorknobs off, that there's no virus in my house. And therefore I still don't really wash my hands as much as if I was out in the world. But is that an inaccurate?
Well, we know the virus, one of the things about this virus is that it can not only present asymptomatic features in individuals, but it can stay alive on surfaces for a matter of up to a couple of days, depending on the surface, the temperature, how porous it is, et cetera. And so we have to be extra careful. But these public health and hygiene messages need to trickle down to everyone. That means people whose English is not their primary language, people who are hearing and visually impaired, as you mentioned, children. This is whether you're 5 years old or 95 years old, everyone needs to hear these messages. And the messages that are being put out there, even by the scientists and public health professionals, is not always in using the words and images that translate to people's actions.
You know, it's funny. I was talking about with my family. My grandmother, who was 95 years old and from southern Italy, where they didn't have the best health care. One of her main things was lavati mani. Lavati mani was always wash your hands. So this is sort of something that we know about already, but it certainly seems almost impotent in the face of a tsunami of disease. Is that just not accurate? The hand washing is really where it's at?
If we followed social distancing and washed our hands, as meaning all the time, last week for one day I chronicled what I did and when I washed my hands. And this is what I do. I'm a public health professional, infectious diseases, and I was like, oh, you know what? I just walked the dog and I washed my hands, but then I played with the dog and then I went and had some snacks.
I had the same thought last night. I'm like, I'm texting people and then I'm getting out the crackers. Ah!
Yeah. Or Amazon delivered my dog food. And so I picked up that cardboard box that it was in, I brought it inside, and then I was touching, on my phone. Like, there's so many opportunities for the virus particles to move on these active high touch surfaces that's really dangerous. So washing your hands with soap and water, we don't need anything fancy. Most of us have access to soap and water. And even before this happened, because I was chronicling my activities one day just to see, am I just being paranoid or is this really happening? I went to the gym and probably half the people who left the bathroom didn't wash their hands after they left the bathroom.
Yeah, someone in our chat says 50% of the population doesn't wash their hands after using the restroom.
I went to CVS. Someone was hacking into the shelves like nothing was happening. I went to Stop and Shop. A kid was just coughing and then touching the cart. So like just simple things like personal hygiene will go a long way. There's only so much we can do, and that's the first and easiest thing.
What about spraying Lysol everywhere?
So disinfectant.
First of all, you can't get Lysol anymore. It's all sold out everywhere. But
we have to control the hoarding. I know people are in a bit of hysteria and very anxious, and that causes us to want every roll of toilet paper and paper towel and Lysol. But let's keep calm and relax a little bit. Disinfectant wipes are great for high touch surfaces. So, I wipe down the outside of my front door and our kitchen island and countertop that we're constantly putting things on and taking things off. I wipe down my phone once a day. I'm not obsessive. I'm not wiping everything down every hour, every minute, but once or a couple of times a day, I wipe down the most commonly touched surfaces that I have control over, like my house or in my car and those kinds of things.
Okay. That's good, because I did wipe my phone 3 times yesterday because I feel like I touched it, then I touched them. Oh, here's another question. A lot of people the only place that's open for people to go is the park. Is there any evidence that these viruses stay alive on the grass, on the trees? Like
Yeah.
Do you know anything about that?
Part of this being an emerging situation is we're learning as it's happening. And so, depending on which reports you read and which scientists you follow, you'll see that how alive the virus is really depends on the surface, the temperature, how porous that surface is, and how much virus is actually on it. And so, thankfully, this is not airborne. Something like the measles is very contagious because it remains active and alive in the air for a period of time after someone leaves. This is not what we're talking about. which is why last year when we had the measles outbreak in New York City, it was also a public health emergency because, like I said, that is much, much more contagious. But,
How is
the
it possible that the measles are not outbreaking right now? It's not like people went and got vaccinated.
well, let's keep our fingers crossed that we have one public health emergency at a time right now.
I mean, I know
But,
I really had
but,
that question. I mean,
but
last year this was like a whole big thing, and I don't think a lot of the communities who were not
yeah.
vaccinated went off and got vaccinated. That's not my
But
understanding.
to that point, other health issues are not going to pause or stop because of this.
Mhm.
And that goes also to the issue of healthcare capacity. People are still going to present to the emergency room. People are still going to need critical care interventions. People are still going to need cancer treatment and dialysis and all sorts of things to maintain their health and well-being. And those things can't stop, which is why you're seeing our healthcare system fizzle a bit right now because it's on overload.
You can ask questions in the chat on Facebook and or on Twitch, and I will get them to our guest. We do have a question here.
Okay.
Dost for you says, I have inside and outside clothes I change when I go
Mhm.
out and come in. Is
Mhm.
this being overprotective?
No, I think that's a good strategy, particularly because again, we usually don't pay attention to our everyday movements because we just don't think about them. Like so, I try to go for a good solid walk every day to get fresh air, clear my mind, unplug from all devices. I take the dog out several times a day, but I keep my shoes at my front entrance. I change my pants. I've never done so much laundry in my life. Things like laundry detergent kill a lot of germs and viral particles. So that's a good strategy.
I'm glad soap still works.
Soap still works. Soap is one of the best
Soap
things.
is the big thing. Why is there no run on soap? And
I,
it's all toilet paper.
listen, I tried to go stock up on some just hand soap, whatever, bar, liquid, doesn't matter. And even my local grocery store was pretty wiped out when it comes to that. But we just got to be.
Amazon.
Grocery stores are an essential service. They will continue to remain open. I certainly think the people who are stocking those shelves and working those should be being paid double and triple time for their service.
It's a war zone in the Key Foods in Park
Oh,
Slope. It's awful. It's not,
um,
it's stocked, but the level of tension in the
yeah.
store, and they are wearing masks, but still, it's really
So
awful.
you just touched your face.
Ah! I'm gonna wash my face. Should we be washing our faces also?
Listen, I think if we're washing our hands, but also being exactly if we're washing our
Yes.
hands regularly, then
Okay.
if you touch your face, then you don't have to worry so much about it.
I mean, at some point, it's just absurd. I
Yeah.
know this is hard. Dr. Santella, can you tell us about the program that you're running for the
Yeah.
children?
So I'm gonna take a moment to do a little self promotion.
Please
So
do. This is a
so
service that you're putting out that we absolutely need. So I'm happy that you're doing it.
okay, thank you. So I mentioned earlier, no one should be left behind when it comes to the key messages. Doesn't matter whether you're 5, 10, 15, 50, 100 years old. And one of the areas where I think we haven't done a good job is with children and teens, particularly because this is a very anxious period. Their schools are closed, they're not able to see their friends, a lot of their family members. They're used to being very playing sports and going to schools and doing all these things, and now that's being restricted. And so, what can we do? We should be implementing age appropriate, medically accurate information. So, I've developed one webinar for the K to 8 crowd and one for teenagers in high schools.
And these
If
are free? Is that
if
correct?
they're free. I'm
Excellent.
offering several each week, and I'll offer them as long as people sign up and register for them. My website, anthonyjsantella.com. Just Google me, you'll find it. There, half of it is a presentation, and half of it is live Q&A.
Mm.
We've had close to 1,000 children register so far, including teachers and school nurses and principals and administrators. Everyone needs to hear the message about what is a virus? How do viruses work? What is the coronavirus? How did this start? How do we keep ourselves healthy? How do we stay socially connected and engaged?
Mm.
So these are everyone needs the message. And as a public health professional and infectious disease specialist, I thought this was something I could do from the comfort of my home and, translating that knowledge for the younger generation.
Asking for a friend. Well, how do you talk to kids who are beneath school age about it? Because my daughter's noticing people, she's 4, noticing people wearing masks, and we're asking her to wash her hands more, which she hates.
Yeah.
And her hands have cuts in them because of all the rough and tumble play. And so
Yeah.
she hates the hand sanitizer too. You know, we've become
So
authoritarians in the hand washing. And yes, I just touched my face again. Yes.
see, but at least you're more conscientious of it now.
Yes.
Um,
If you've saved one life, it might have been mine.
so I think everyone, doesn't matter if the child is 2, 3, 4 years old, can understand the basic principles of keeping ourselves healthy. And how do we do that? Anyone can understand washing your hands, right? And so germs are bad generally. They can make us sick. And one way we can eliminate those bad germs is to get rid of them. And our hands are our most precious part of our body because we need them for almost everything: to write, to use a phone, to type, to communicate. And so we need
Yeah.
to preserve our hand and hand hygiene. And I don't think a 2 or 3 or 4 year old doesn't have the ability to understand that. Explaining other things like, well, why do I see people on TV upset? Or why do I see people wearing masks? We have to use, like I said, age appropriate information. And that's unsettling for a lot of people. It evokes a lot of issues of emotional and mental health and well-being, and really that's for a parent, guardian, caregiver to decide how to best translate that. The part of the reason why I developed the webinar is I want to give people, regardless if you're a child or an adult interacting with a child, the words and the concepts, breaking down these complex scientific and public health concepts into digestible bites that anyone can understand.
You're like the Daniel Tiger of public health. Daniel Tiger is for the parents. It teaches you how to deal with different situations, gives you a song to sing. It's fabulous. Questions coming in. Does washing your clothes in hot versus cold matter with the virus?
Um, Not really. It's more about using detergent and soap. That's
Okay,
really
so
what,
don't
just
wash
like
your
the
clothes
soap
with it.
breaks down the virus on our hands, the detergent will break it down on a surface like your clothes.
Excellent. Um, well, any final thoughts before we head off? And I just do want to thank you so much for being here with us, and for doing the work that you're doing to help the parents and the kids feel, secure in a certain way of, in this time of insecurity.
You know, I just want to just remind the viewers and listeners that yes, these are uncertain times, but this is why we have public health workforce and public health systems. We've been using these methods of quarantine, isolation, social distancing. These are not new things in the field of public health. They've been trialed and they work. And so do your part by staying home and washing your hands.
Thank you so much. We've been talking to
Thank you.
Dr. Anthony J. Santella. You can go and Google Anthony J. Santella on the internet and you will find a way to sign up. I will put the links in the chat, and share with your friends. And thank you so much for joining us. I really appreciate it.
Thank you. Have a great,
I hope to have you back under better circumstances.
please. Thank you.